one of the other things that I did want to talk about is different peroxide choices that we have. Once you've made a decision to use a peroxide system, are all the peroxide systems the same? We have generic systems now, and certainly I think there are differences. Has anyone found significant differences? Are patients using generics?
I can tell you practically, we've had more of a few bizarre situations with the store brand products in terms of what I'm going to describe as the quality of the caging or the systems that they're actually contained in. I've actually had a few patients come back and say that they used the store brand products and they broke on them. So they just decided to continue with the ClearCare because in their minds they felt that it was just structurally put together better, and there was a certain level of trust in that. Certainly from a historical perspective, and again, I'm speaking from 10 years, not however long you've been practicing.
Not 100 years.
But we've had such good, strong success, and we've built up this strong level of trust with the ClearCare brand, knowing that we're going to get a certain level of consistency every single time, which is strong disinfection and very clean lenses. Very clean lenses.
One of my really big concerns, and it goes back to an article I wrote in 1990, is residual peroxide. And one of my concerns is that some of the products have much higher levels of residual peroxide, and I think that can be an issue. Chris, Sint, any thoughts?
Well, keep in mind our body has a way of dealing with residual peroxide. Okay? Some people are going to deal with it better than other people. Some dry eye situations may not deal with it as well as people who have a very thick and robust tear film. And so the amount of residual peroxide that's left in the container is really going to depend on the eye that you're putting it on. So obviously, if we can make the residual peroxide as low as possible, we're going to be able to have comfortable and happy eyes on the greatest number of our patients out there.
Well, I think that's a great point, and the point of this series of case studies that I wrote up was really looking at relatively low levels of residual peroxide producing keratitis in some patients. And actually one patient went on to have a bacterial ulcer on a cruise ship, of all places. So the concern is we want to achieve 0% residual peroxide ideally. We can't always do that, but the less we have, I think, the better it is for the patient. So I'm concerned about generics. I'm concerned about strategies that would increase residual levels, and I think we all need to recognize that can be one major issue when it comes to peroxides. Yes.
I can't say that I know much. This is Loretta, about the peroxides that are generics on the market. I was actually pretty surprised once when I walked into Target and saw a bunch of peroxide systems there. So I think the reason I'm not concerned about it is because my patients never tell me they're using it. Going back to the compliance issue of peroxide users being compliant, it's actually the only product that they can name by name. When they come back into the office, and we always ask them, what solutions are you using? The technicians always, one of the first three questions they ask. ClearCare is always named by name, whereas the MPSs, they can't remember the name half the time. So I don't think any of my patients, I shouldn't say any, but most of my patients do not buy the generic product.
I had a colleague call me recently, the last couple of weeks, and it's funny, generic peroxides can do funny things to your lenses, and including turn the lenses pink.
Yeah, nice pink. Yeah.
A nice pink color, and I think maybe we've all seen that, happen. So, the purity of the peroxide actually matters and actually is important.
That is true. I have seen a number of those cases and especially when patients use over-the-counter store-bought peroxide that's for disinfection. You can add all kinds of weird things. So I think the key here is, just because it's peroxide, just because it's ClearCare, we don't have that cushion anymore where we can assume that they're only using ClearCare. So we have to reinforce specifically the product that we're prescribing, and just make sure they understand that we don't want them using a generic. Chris, we're gonna.
I just thought Loretta's comment was really interesting, and I find the exact same thing. Even though I practice in a very poor inner city patient population, patients are very brand loyal with ClearCare. I also don't have a patient respond, what type of cleaning system are you on, say hydrogen peroxide. They specifically call out ClearCare. And so I would be very much willing to say that I don't believe my patients are using generic peroxide.
Right, and the other side of that coin, and in ensuring that they're not, even though we're believing that they're not, and you're probably right, many patients do make that distinction, is also instructing them to replace cases and not to top up. Just touching back on the compliance issue, even though we think, why would a patient top up with peroxide? They do top up with peroxide, and we know that that's a strategy for massive failure, which we have to certainly be cognizant of.
Can I just add one thing
You certainly can.
what everybody was saying? I think it's important. I think one of the ways that we try and safeguard against these types of things in our practice, and although this sounds kind of basic and rudimentary, it is so effective, and it gives us a true real picture of what our patients are doing with their contact lens care. Our message is simple. Whenever somebody calls our office to schedule an appointment and their contact lens wearer, they're told to bring in their contact lens case, their solution, and any products or drops they might be using to care for their lenses or their eyes. And then when we call them the day before their appointment, we give them that exact same message. And the reason why is we just want to safeguard and make sure that people are actually doing and using the products that we ask them to use and how to actually use them.
Actually, that's a very, very good strategy. I think it varies from practice to practice. In some cases, you wouldn't see that at all. Patients just wouldn't comply with bringing in their cases and their lens care products. It's just the nature of that. Okay, so let's see. One of the things I wanted to talk about.
You had enough questions on your thing.
No, we're
You sat through the last like 2 days there, Art.
we're taking a momentary break. I have a lot of.
Are you going to talk about
Oh yeah,
the
okay,
risk
I
of
got that.
ATF amoeba? I mean, how big a risk really is it?
Say that again, Bill. Sorry.
Are you going to talk about the real versus the perceived risk of ATF amoeba?
Actually, I will be talking about disinfection in more detail again. We're going to go back to it in a sec. I just wanted to comment on, has anybody seen Safflon as a product? They sort of made massive inroads. I know in the private label market, they actually sell their own products, but they literally are on the market for peroxide with a number of different brands. Has anyone encountered any of those products or aware of that?
I'm aware of it, Art, but I haven't had any patients utilizing those products.
Well, I think you actually have, because they market it under other brand names. So, I think that's an issue. And the product is, not anywhere near ClearCare in terms of its quality, at least in my experience. But it's, and that's interesting, because we often don't know what's in the bottle. And that's, to me, very, very frustrating. As a clinician, I want to know what I'm prescribing. And I think in this time of generics, I think that becomes increasingly difficult. I wanted to talk about, before we get back into making choices and disinfection as an important element. I wanted to talk about biocompatibility. One of the big issues that we've had and we faced for probably the past 3-4 years is corneal staining, and I know corneal staining has been minimized because of commercial interest, and the significance and relevance of it has been questioned. To me, corneal staining is a big issue. What have been your experiences with peroxide and corneal staining? Bill? Chris?
Go ahead. Chris, go ahead.
You can get corneal staining in any contact lens related corneal staining in any patient who wears contact lenses. staining. So, there's always going to be some level of corneal staining if the patient's actually wearing the lenses. Certainly, we know that certain brands of contact lenses, certain brands of solution are going to induce more corneal or conjunctival staining. And in the research that I'm doing looking at confocal microscopy, we definitely see relationships between the level of corneal staining and the amount of dendritic cell infiltration into the tissue. So we know that corneal staining, based on the work that I'm looking at here, that on some level corneal staining is driving, at least driving inflammatory cells on a subclinical level, if not on a clinical level itself. So, going back to your question, do we see corneal staining in patients that use Clear Care? You absolutely can see corneal staining in patients who use Clear Care, but it may be lens dependent, but it may not be to a level that we would consider clinically relevant.
Yeah, well, actually, you mentioned dendritic cells. I just want to reinforce for our readers that dendritic cells are inflammatory cells that appear within the cornea, and maybe
Antigen-presenting cells.
Yeah. Oh, yeah. Okay. And I want you to go into it for just. I try to simplify it, but I want you to go into it for just maybe 30 seconds. Just describe your work briefly, because I know it's not relevant specifically to peroxide, but it's more general in terms of contact lens disinfection systems. But it is of interest.
So the research that I'm doing, we're looking at various contact lens solutions and various types of contact lenses, and to see how corneas respond to wearing contact lenses. So we've looked at established contact lens wearers, and we've looked at neophyte contact lens wearers to see how they respond to wearing contact lenses, and to see if there's a relationship between contact lenses themselves or contact lenses and specific solutions.
Okay. Well, you made comments about staining. I find that peroxide produces probably the lowest levels of staining of any of the solutions that I use. Some produce very low levels to start with. Some produce very high levels. Peroxide, Chris?
I totally agree. I would say absolutely is one of the least in terms of across brands, across lenses, across lens materials. I've made it a habit in the past probably 18 to 24 months after doing some clinical trials, specifically looking at corneal and conjunctival staining, to really look at the raw cornea before I put anything in, before I put in fluorescein, before I put in any type of a drop. If there's significant keratitis on the or staining on the conjunctiva, oftentimes it's very, very visible before anything goes in, and the fluorescein oftentimes confirms what I've seen on the naked eye. And it's concerning to me as a practitioner, but I would absolutely agree that I see consistently across brands low levels of staining with hydrogen peroxide systems in general.
What you just said was absolutely, I think, critically important. We sometimes forget that fluorescein is just a disclosing agent, and what you're seeing with fluorescein is just an exaggerated version of what you should be seeing with naked light if you're a good examiner and take the time to examine. So when we talk about staining, we really are talking about disruption of the cornea. I'm not talking about staining, as an artifact. I'm talking about staining as something that you can see without fluorescein, and I think we need to make that distinction. Chris?
I want to really, if I could go back to looking at using the confocal microscope and looking at staining and inflammatory responses on a cellular level, I really do want to drive home the fact that peroxide is not necessarily better than certain MPS solutions. Okay? MPS solutions can be very effective and can be very safe with staining and with dendritic cell migration into the cornea, just as peroxides can as well. They're not necessarily better than certain MPS solutions. MPS solutions can be very safe. However, there are certain MPS contact lens solutions that do cause staining and do drive dendritic cell migration into the cornea and into the conjunctiva. Does that make sense?
Actually,
on a cellular level, it's not necessarily better. It's very good, but there are MPS solutions out there that are very good as well.
And I think that's an important point. And I think for the people who are going to be reading this, we should make it very clear that what you're talking about is polyquat aldox producing relatively low levels of staining, very similar to peroxide. And you're talking about PHMB-based solutions producing significantly higher levels of staining. And that staining isn't just staining by itself, but staining is also inflammation, and staining is also changes in comfort.
Staining is definitely linked to inflammation.
Right, and
Okay. It's also
yes, Bill?
definitely, there's an article that we read in our homework assignment, and we knew this sort of inherently, but now there's evidence that shows that staining is definitely linked to discomfort.
Correct.
We've all seen people who come in, they have tremendous staining, and they don't really have discomfort, but by and large, there is an association.
And I think that may be one of the reasons why I find that peroxide is so comfortable for patients. And I think that's traditionally been well accepted. Neil? Well, actually.
Well, one thing about
Ladies
corneal
first.
staining, I've been looking in a large trial I just completed at corneal staining very closely, and in peroxide users were one particular arm. And staining can happen in a peroxide user, but it's different. You're very right, it's very, very low percentage, very, very low incidence. But when it does happen, it doesn't look like solution-induced corneal staining. It looks mechanical to me. They're larger macropunctate stains in the inferior third of the cornea or central cornea. It's very lens-related, very mechanical. And in those patients, guess what they do better in? An MPS that has, some of the wetting agents in it. So it's similar to the dry eye discussion you were having before. So it can happen, but I think it's not solution related at all. It's mechanical, perhaps dry eye.
Interesting. You're going to comment on...
Well, I was, but I think I'm just echoing what everybody else is saying. I do find a high level of efficacy with Clear Care, and I do find low levels of corneal staining. I mean, it's just something that will reliably do what it's supposed to do, period. Loretta, I would echo what you're saying. Sometimes you see some mechanical issues, but those look very, very different clinically than that solution-induced staining because of where and how you're seeing it on the cornea. Fortunately, we have this option for those people who do have hypersensitivities. Fortunately, we're fortunate that we have this option for patients who do experience these issues, who do have all of these other issues that we talked about, and we can bring these patients back into a system like Clear Care that just will fix a lot of these, I'm not going to call them benign, but these almost problematic issues that will at times cause patients to find contact lenses more burdensome than beneficial, and we can just bring them back to a level of normalcy. I'm wearing my contact lenses again and I'm not aware of them anymore. And a lot of that has to do with almost everything that we've been talking about. Corneal staining, conjunctival staining, clean lenses, and a high level of disinfection.
Well, one of the things that we're actually not talking about that we probably should, and to your point about staining being very different with peroxide than it is with MPS is we're not seeing uptake and release as an issue with peroxide. When we look at products like PHMB based disinfectants, we're literally seeing uptake into the lens and then release back out into the precorneal tear film, which reaches toxic levels and produces frank staining, and at the same time reduces potentially the efficacy of the disinfectant through uptake. Yes.
I'd be careful about that statement going into print.
Oh, when have I ever been careful about statements going into print?
The reason is because there's some evidence that there is uptake and release of the peroxide. It's just handled differently on the eye, and different materials are going to handle it differently. The thing is that our bodies have ways of handling peroxide that's released back into the tear film that is very different than the way our body handle say PHMB as it's released back into the tear film. And so our bodies don't have a way of neutralizing the other disinfectants necessarily, whereas it does have a way of neutralizing the peroxide. And so, more evidence, there needs to be a lot more studies out there, and in a year or so we'll be talking things a little bit differently. But I would say that, peroxide uptake and release is more of an intelligent, biocentric design than say some of the other chemical disinfectants.
Well, I would agree with one caveat. If you have a system that neutralizes peroxide down to 50 parts per million, the equilibrium that will be reached will be that there will be 50 parts per million in the lens, more or less, and that is so relatively little that I think, to your point, the body.
Unless the plastic is hiding it.
Yeah, well, that would assume, and then we don't know that. That would assume that
right,
some.
and that's where there's going to be we'll know more.
I sense research. I wanted to, we still have some time, but one of the things that I wanted to talk about was deposits on lenses, and that's an area that I'm actually very much involved in and planning some research. And does peroxide reduce deposits, and what's the clinical significance of that? Go ahead.
Depending on the brand, as we talked about earlier, the surfactant additive to Clear Care does have an impact on deposits. It is dependent on lens material. It is slightly more effective on certain lens types than others. The whole class of silicone hydrogels is still very, very challenging. So it has an impact. I'm not sure how substantial it is, and it does vary across brands of lenses.
Yeah, that's interesting. One of the things that I'll share with you, and I don't know if this will make it into print, but the less deposition we get on lenses, particularly silicone hydrogel of lipids, the more stable the tear film. So when you have a product like a peroxide that lyses lipids and doesn't allow the surface to become increasingly hydrophobic, more lipids stay in the tear film, and lipids actually are quite functional within the tear film. So I think that's an area that we're going to be looking at in some detail.
Were you saying, Art, that there are certain deposits that can create the lens surface to be more hydrophilic?
Correct, and silicone is innately hydrophilic. Some of the different lens materials have a lot of silicone exposed to the lens surface, which produces an attractant to lipids, which are hydrophobic. And the more hydrophobic the surface becomes, the more lipid is attracted to the surface, and it builds up and it builds up and it builds up. And if you're taking a lens that's used for a month, and you're taking a lens that's already biased towards hydrophobicity, you're actually just spiraling things further out of control. And it's an area obviously that we're quite fascinated with. So peroxide is a strategy, I think, for minimizing at least some of that hydrophobic buildup, because its ability to break down lipid deposits. But that's an area for further research.